My name is Dorlan Kimbrough. I'm a neurologist and I'm working in the multiple sclerosis and neuroimmunology division. I see patients with a variety of conditions that affect the immune system. Multiple sclerosis is the most common one, but I also see patients with neuromyelitis optica. Some patients may have complications of other conditions like sarcoidosis that affects the brain or the spinal cord, and there's a dozen others, but those are the main conditions. A lot of times you're trying to meet the patient where they're at in terms of, is this something that we need to tackle the entire thing today in an hour, or is this something that we need to kind of take piecewise and start with what happened, we come back, and then maybe deal with what the implications are, and then later on really dive into the treatment. So you kind of want to make sure that you're not overwhelming somebody with, we're going to do everything in an hour, and at the end of it you have a million questions and you didn't quite get time to answer them. I want to make sure that every stage has enough time so that people can really settle into the long haul of taking care of a chronic condition. Oftentimes people come to clinic and they're very frightened because they've gone to the internet and they see a million things that could go wrong, and maybe they know someone from their own personal life, or they've met someone who had a really, really difficult time with their illness. And one of the things that I'm happy that I'm able to share is that what we're treating today and the way we're treating things today is vastly different than what the situation was a couple of decades ago. So there are a lot of patients who come in really frightened about the future, but that future is going to be very different from them than it had been for decades, really. So there's a big opportunity to help change an outcome for a patient.